Now to our new series, Two Americas, which is exploring different viewpoints and highlighting communities you may not know about. Simply put, it's the America you know and the America you may not. We're digging into the mental health crisis among veterans. Ryan Jenkins goes in depth to understand the cause behind the rise in the number of veterans who have died by suicide over the past 2 decades and shows us the resources that exist now to interrupt this troubling trend.
The pandemic and conversations surrounding politics are impacting all of us every day, but the impact those things are having on the mental health of veterans seems to be disproportionate. It's part of the reason why telehealth and emergency crisis hotlines like these are becoming so important.
When I came home, I was so used to in the military world that everybody counted on me.
Chris Swift served for nearly 6 years in the U.S. Army as a medic in both Iraq and Afghanistan. He came home when his daughter was born.
Me, I lost that purpose when I came home. You know, I had my daughter, but I lost the purpose of other people counting on me. I had a lot of survivor's guilt.
Over time, his mental health deteriorated. He hit a low point 3 years ago when a close friend died by suicide.
One of my best friends died March 5th, 2018. I talked to him the 3rd and I talked to him the 4th, and then on the 5th his mom gave me a call and said that he had died. I really spiraled after that.
Chris abused alcohol and quickly racked up 3 drunk driving charges, eventually ending up in the Ozaukee County Jail, contemplating taking his own life.
I was one of the people that transitioned very poorly.
This crisis is far too real for those who have served in the military. According to the U.S. Department of Veterans Affairs, an average of 17 veterans die by suicide every day. Chris says he got help and turned his life around thanks to the Milwaukee VA.
We're lucky in Milwaukee. This VA has everything.
Dr. Bert Berger is the mental health division manager at Milwaukee's Milwaukee VA hospital. He sees people like Chris on a daily basis. Dr. Berger says while suicide rates are up over the last 20 years, it's higher for veterans and those living outside urban areas.
The rate of suicide is actually higher in our rural population.
Part of the reason why is because it's harder to connect those veterans to mental health resources. The main VA hospital is in Milwaukee, but there are branches in Appleton, Green Bay, Union Grove, and Cleveland, Wisconsin. Dr. Berger says each one of those covers a 30 to 50 mile radius. Outside of those areas, telehealth plays a new important role.
The way that psychiatrists and psychologists can work with someone in the rural area is really effective by using these systems as well.
Now the challenge is letting people know what resources exist.
Obviously there's a stigma surrounding mental health and suicide, so how do we break that and let people know, call this number or make that telehealth appointment? How do you get there? How do you get through to those veterans?
Yeah, you know, that's a tough thing because veterans are proud. They've served their country. They don't want to admit that they have a problem or admit to defeat in any way. So admitting like they have a mental health problem is really difficult.
For Swift, he says veterans know how important their bond is.
There's nothing like the camaraderie you have, the family-ship that you have in the military.
He says now they must work together to end the stigma associated with suicide and mental health. Ryan Jenkins, TMJ4 News.
If you or someone you know is struggling, help is available. The Veterans Crisis Hotline can be reached at 1-800-273-8255. You can press 1 to get connected to someone right away. There are also 2 new websites specifically focused on veterans' mental health and suicide prevention. Both of them can connect those who need help to local resources that are available right now. The VA says all veterans and caregivers should check those sites out.
All right, so we have links to each of these stories on our website, tmj4.com. We also have several other stories like this one in our Two Americas series that's available at tmj4.com/2America.